on YouTube afterwards, so you can see it if you do have to drop off for other commitments. And if you do need to go, do chat any questions you've got so that we can still get to them at one point or another. Okay, now there is an awful lot to cover, as I say, in this, because the advice was released by the government recently this week. There is an awful lot in terms of advice from the HSE as well. So I think what I've tried to do is consolidate a lot of the advice here and basically open up for a number of ideas that I've come up with, products that I've seen, and discussion points as well. So all of this really is I guess, a starting point or prompt to help you guys, who I assume are mostly office managers or responsible for your office in one way or another, to get prepared for the inevitable opening up and letting employees back in. So a quick agenda. We're going to go through the latest advice from the government and the HSE, and then our advice off the back of that. Quick furlough information. We have got another webinar, so I'll talk about that very briefly. Health and safety overview and help. Additional points of help and advice. A risk assessment and how to get that done, with an example that I've got available in the portal. Top tips in areas such as premises, people, procedure and policy, products and support, and other resources and webinars that we've done. And then, as I say, we'll open up for discussion and questions as well. So you'll have all seen, no doubt, on Sunday evening, Boris created this new campaign. I have my own views on it. I'm sure other people have theirs as well. To me, the green in the messaging, changing it from red, means that it kind of gives us that signal that it's safe. I would have probably personally gone for like an amber, and then green when it's much more controlled and manageable because we're doing more testing, we've got a vaccine. But anyway, that's the government's campaign, and they're my personal views. So in essence, they say stay at home as much as possible, work from home if you can, limit contact with other people, keep your distance, wash your hands regularly, and self-isolate if you or anyone else in your household has symptoms. So a few changes to the initial stay at home advice. And really, I think on the second point there, they've kind of relaxed it. So there are potentially some people, perhaps you've already had it in your organisation, where they're asking if they can go back into work. Perhaps they live alone, and for them going to work is slightly more sociable for them, or they can't quite work with all the systems remotely. So for them to be more productive, they want to go into the office and access everything from their own computer. So there may be people already asking for that. They then released on Monday, and the links to everything that I think are useful are in here as well, so you can easily click to these other sources. The Get Brits Safely Back to Work guidance. And if you haven't seen that yet, I would say it's really good. I've got a copy up on my screen as well now to help if we need to refer to that. And in essence, they say work from home if you can again, carry out a COVID-19 risk assessment in consultation with workers or trade unions. Maintain 2 meters social distancing wherever possible, and where people cannot be 2 meters apart, manage transmission risk, reinforcing cleaning processes. And the whole document is available there. It's a really good guidance. I've put some quotes in here from the document to help if you haven't seen it, or even if you have, just to kind of reinforce some of the messages that I've taken away as quite key. The government is clear that workers should not be forced to work in an unsafe environment or workplace. So that's really important. Social distancing and advice from the HSE. They've set out their guidelines on how you must maintain social distancing as a business to protect workers and your employees. So employers who have people in the offices on site should ensure that employees are able, where possible, to follow appropriate regulations and guidance on social distancing, which is generally around maintaining that 2 meter or 6 foot distance, and washing their hands regularly with soap and water for at least 20 seconds. I think we've all seen the campaigns in relation to that. There's specific guidance depending on what jurisdiction you're in within the UK here as well. So I've shared some links there that might help to give more information from the HSE. You also will probably see, as members of the portal, that we're constantly uploading the advice to the tips and advice section. Obviously it's evolving, it's changing, we're still learning about this disease, so we are trying to keep up with the advice as much as possible. Obviously you'll need to do the same, And I think the government themselves are trying to keep up with advice that's coming out from their advisors and scientists and so on as to what works best. I would think that in the next sort of 2 to 3 weeks, the guidelines that were released on Monday may be updated, because people will have started going back. They will have all sorts of committees of feedback for this kind of thing, and they will therefore edit and update the advice off the back of some of that feedback and the committees that they'll have set up. So it's really important to keep up to date with it. Our advice off the back of that, it kind of echoes some of it, but stay at home and continue to work from home if this has worked so far. Why break it? Why try and fix it if it's not broken and put people at risk? This is the main thing the government have said, hence why I put that quote previously in bold. Don't force people to work in an unsafe environment. And if you feel like this is impossible, you can't manage social distancing, you can't effectively protect people and stop them from being in close contact for a long period of time because you're in confined spaces in offices or whatever your setup might be, don't force them to go back to work. Give them options and encourage that they work from home. Make sure that you're still encouraging things like the daily exercise and outings, and put on team-based activities. There's quite a lot of guidance from the government and the HSE around this and the mental health elements, so keep doing that, or do it if you haven't been doing it. Conduct a pre-return survey with your staff, employees, and check in and find out their appetite to return to work. If you haven't done that already, I think it's a really good thing to do. And there are a couple of points that will benefit, I think, by doing this. So one is to tune into that mental health and that stress element that the government are keen on, but also that you as an employer will need to tap into and make sure that you're still managing that risk, that element of people feeling isolated and struggling, workload pressures, all the different things that can come with that, and not being in close contact with their line managers. And also it will act, or potentially can act, as your consultation. So there is that element that your risk assessment should be done in consultation with your workers or your unions. So I think by doing a survey, you can start to eke out some of that process, rather than perhaps having everybody in a room or on a video call and saying, what do you think? You can start to ask questions that will help you to produce your risk assessment within a survey or a few surveys. Okay. At the moment, Megan, there isn't a template available for a return to work survey, but it's a good point. I can try and put one together. Okay, communicate what your company is doing following this new advice, if anything, and continue to communicate any further changes. It's really important. And again, another thing that the government have been stressing in this guidance and the document, the mental health factor, the safety factor is in trying to avoid the transmission of the disease between your employees, but also the communication is really key. And obviously start to produce a risk assessment and return to work policy and procedure to prepare for the return to work spaces. I don't think it's going to happen in a bigger scale, or I don't think there'll be an expectation for it to happen really until June, July at the very earliest. I think, and I hope, that a lot of organisations act more responsibly than trying to get everybody back to work, and dry run it for some time, keep testing it, get the workplace ready, and get all the policies and things in, get all the ducks in a row basically, and then do it when other people, let other people be the guinea pigs. Why rush at this? If it's working so far and people are okay and you're checking in with them, don't rush it. Get all your stuff lined up first. So a bit of furlough information. I am not a human resources expert. I probably know as much as you do, if not perhaps less, about furlough, but I wanted to just cover it in here for anyone that just needed a little bit of information. We have got a separate webinar, a couple of separate webinars with some HR experts over the next few weeks. So sign up for those if you want to talk about furlough and the lockdown side of human resources any further. But being put on temporary leave, but being kept on payroll is known as furlough. You can get a grant using the coronavirus job retention scheme, which I've put a link to in there as well. Everyone who's furloughed has to be furloughed for at least 3 weeks. You can't do it for any less than that. So if you have put someone on furlough and you want to then start using them again, you can't. You would have to then put them back on the payroll and not not consider them as ever being on furlough, or you would have to keep them on for that 3-week minimum and then assign them work. People should not be working at all. No admin, no, chatting to colleagues about work during the time that they're on furlough. It's highly unlikely that the government are going to, HMRC are going to be able to do checks on that, but it's really not worth the risk. So I think there's some more advice on here about it, but employees can go on and off furlough as long as it's on that 3-week basis. So we know that it's been extended to end of October, I think it is now. So people can go on and off, and it might be that you decide to rotate as a workforce who goes on, who goes off. You can continue to communicate with them, and I think given what I said on the previous slide about communicating what the return to work might look like, it's really important to do that. But if they are on furlough at the point that you want to communicate, try and use alternative methods to the company email addresses or corporate phone numbers and things. Use a personal email address if you have access to it and permission to send emails and contact about the company to that, but still include them in your return to work plans. Make a record if you've got consent from to email on their personal devices or personal numbers as well. Health and safety overview. So it's, health and safety is a big piece of work to cover. So I'm giving you a very quick high level about it here, just to give some understanding of, again, how the HSE and the government are viewing this in relation to COVID and how it all connects to the main Health and Safety at Work Act. So there's the Health and Safety at Law poster there. Everybody should have that displayed in their offices. It's an employer's duty to ensure, so far as is reasonably practicable, the health, safety and welfare at work of all of his employees. You must write it down if there's 5 or more employees. And that can count as contractors that regularly work at your premises as well. So if you've got, 4 employees on payroll and 5 contractors that regularly come to your office, daily, weekly, and are sitting at your workstations, it will probably be best to put those procedures in writing as well. And the HSE has been advising of an increase in inspections and checks. I think they've, I saw something the other day that the amount, I think it's like £100,000 or something to that effect, of additional funding to support inspectors going out and looking to make sure that businesses who are saying this is what we're going to do are actually following through and doing it. They'll make sure that you're enforcing your policies and actually that you've got policies in place. So regardless of COVID, this just kind of puts us at a little bit more of an exposure at the moment in terms of our normal health and safety obligations and practices that we should already have in place. So do make sure that you know your responsibilities and you have got documents in place, particularly if you've got those 5 or more employees and you're ready for an inspection at any time. So what is reasonably practicable? It's a narrower term. This is taken from the HSE website directly. So it's a narrower term than physically possible. A computation must be made by the owner in which the quantum of risk is placed on one scale and the sacrifice involved in the measures necessary for averting the risk, whether time, money or trouble is placed on the other. I've put an image here of a balance of scales, and for anyone that's done NEBOSH or IOSH training, you'll recognise this kind of system and way of thinking it up. So they look at risk as being an injury, illness or danger, and then the sacrifice that you might have to make to eradicate or minimise that risk as time, effort and cost. And it's all about the balance and making it reasonably practicable whether you can do that. And here's a couple of examples. So to spend £1 million to prevent 5 staff suffering from bruised knees is grossly disproportionate, clearly. But to spend £1 million to prevent a major explosion, which is capable of killing 150 people, is much more in proportion with what they would expect you to do. So hopefully that gives a little bit of background, because as I say, they keep talking about reasonably practicable throughout the document and the guidance that they have done. And I think it's important to bear it in mind throughout your risk assessment as well. So health and safety, continuing the overview. Legionnaire's disease, basically, I think there's a number of things that you can do and keep in mind, and you can put these in your risk assessment as well. or in your policy as to what you should do before going back to work. And these are some of the items. So keeping in mind Legionnaire's disease, review your existing water risk assessment. You should all have one. I think it's every 5 years for your offices, or when you make a significant change to your water systems. So review that water risk assessment. If you really want to be overcautious, you could get your risk assessor back in to redo it. I don't think that's necessary, but that is your call as a company and what you've got to spend. Carry out flushing, descaling and temperature testing. So they're all things that should be done regularly. I think it's quarterly descaling, weekly flushing and monthly temperature testing on outlets. So taps in your toilets, for example, they should be checked for temperatures, and I've got a little bit more detail in there, I think, as well. Emergency lighting, test all fittings and making repairs as necessary. You know, no one's probably been in your offices in these premises for some time, and just because you haven't been doesn't mean that any of these obligations change in any way. So make sure that you're carrying out those tests and that everything is working as it should be, as if you'd never been away. Air conditioning, check to ensure maintenance is up to date, run the systems before permitting staff back in, filter cleans, etc. One of the other things they say in the document is about the capacities, because your air conditioning system would have been built and configured in mind with the amount of people that would generally be on your floor or your floors at any one time. So if you're doing skeleton staff, for example, and you put your air conditioning system back on, people will probably find it's cold, particularly at the moment in summer when we tend to pump out a little bit less heat. They'll probably find it's cold because it's putting that aircon out at the capacity as if you're, you know, at your 70, 80 staff, not your 10, 20. So have a look and talk to your engineers about that kind of thing as well, and make a new plan if you need to. Cleaning, carry out a deep clean the windows, desks, your IT kit if you can. You know, dust will have created, it's been a couple of months for most of us now since we were last in the offices. This is something that we covered in the WINS webinar as well, so I've just reiterated some points here. And the toilet bowls, Alan mentioned, you know, there probably will be smells from the toilets because they haven't been touched for a while, you know, and they're all connected to sewers and things. So really go in and have a look at that, and what methods are you going to use, you know, electrostatic cleaning and fogging and all these other things that are available. Increase your frequencies and hand washing. First aid provisions, do you need to adjust them at all? Join with neighbouring businesses, check your supplies and top them up. You know, they might have gone out of date. Certain sterile wipes and things will have expiry dates on them. And I've also put here, consider keeping your first aid box with just one person, or just with your first aiders each having a box, again depending on the size of your business, to control if they're not already. If they're in common parts like your kitchens, etc., take them out before you open up the offices and keep them with yourself or your receptionist or whatever it might be, because you're then reducing the amount of touch points available to staff by going in, helping themselves to plasters and that kind of thing. They have to come to you. And I think that's good anyway in general practice, because then if they've had an accident, they have to report it to you. Obviously, if they cut their finger on a bit of paper, you don't really want to know about it, but it's generally good practice to do that. We were talking yesterday, we had a members meet up yesterday afternoon about first aid provisions as well. And one of the things I think that came out of that was quite good was to, before you go back, try and get hold of the other tenants in the rest of your building, the other office managers, facilities managers, whatever their title may be, anyone that's responsible like you are for maintaining that office and looking after the health and safety of your employees, and chat with them, find out what they're doing. Don't reinvent the wheel for a building that's effectively going to be run the same way. Find out what your building management are doing as well. You might be able to mimic each other's policies and procedures, particularly in the common parts, and use the cleaning teams and first aid provisions and so on. So if you haven't already, try and get that set up soon and lean on each other for support and advice. And tell them about the portal. Fire safety provisions. Monitor numbers of staff on site and fire marshals and wardens available. Obviously, it's going to fluctuate, especially if you're doing phased people going back, or you're having specific teams, and we'll talk about that a bit more shortly. Consider appointing additional people to take those responsibilities and whizzing them through a quick training, perhaps on e-learning, or doing a webinar with them to go through training. And make sure all staff that are going back are refreshed on your fire safety procedures. You know, everybody has been affected in this in completely different ways, and I'm sure they'll remember the building, particularly if they've been at work for some time. But you may have had some new joiners that were still getting to themselves familiar with your building. You may have people that have suffered mental health breakdowns during this, that have just completely lost grip of, you know, of what's going on, and they just need a bit of a refresher. So do it to everybody to make it fair. Send them slides, send them a document to read and confirm they've read it, but make sure that everybody knows the procedures, the exit routes, and the assembly points. And housekeeping, do a thorough check on leaks, fire equipment, your extinguishers, and placement of doors, and closing times, comms room, cabling, etc. You know, probably really something that's common sense, but good to highlight. Riddle reporting. So there's been quite a lot of talk on this, and again, they've released some, I think, for me, clearer guidance on it. So we'll go through that now. But you essentially have to report any suspected COVID-related illness, be it contraction of the disease or death, where it is not possible to prove that it wasn't contracted at work. So if you open your offices up and somebody reports that they have got COVID and they're self-isolating, you know, it's confirmed that they've got it, and they are off ill for 2 weeks, 3 weeks, whatever time it might be, or should, you know, the worst happen and unfortunately they die from it, you need to try and find out whether it happened through other means than work. And if you can't prove that, then you have to report it to Riddle. So let's say, for example, they ring in and say, look, it's confirmed I've got coronavirus, but my friend John had it and I saw him last week out at the supermarket. I may have got too close, so I probably got it from him because he said he was still suffering, or whatever, you know, whatever it might be. And hopefully that wouldn't happen because that would just be stupid. But if there's that proof that you can kind of trace it elsewhere, if not, you have to assume, because the working environment is you know, less controllable than somebody being in their house and going outside for their daily exercise and so on, you have to make the assumption that it's possibly come from work and you need to report it. And as I've put there, the starting fine is £20,000 for failure to report, particularly if it's a death. So make sure you're familiar with that. These are the reporting of injuries, diseases and dangerous occurrence regulations of 2013 anyway. So you can see there they've just edited it to talk about how this happened, how this might happen and what you need to report. Yeah, and there's reasonable evidence. So it needs to be reported as a disease as well, probably the most obvious one. And if you don't already have someone, make sure you appoint someone that's responsible for reporting to Riddle. They know their responsibilities and the latest advice in relation to COVID, and that all staff are aware, again, part of your communications, perhaps working with HR, that all staff are aware that they have to report if they have coronavirus or they're suspected of having it, and to update you, your HR team, so on and so forth. And if someone in their household does as well, I think that's really important. Okay. Lone working. So there's been, again, a fair bit of talk about this because people have wondered quite rightly whether individuals who are working from home, even if they live in their own, in a household with others and perhaps are in their own environment, or particularly if they don't live with anyone else, if they're considered as a lone worker. So regardless of COVID, a lone worker is someone who works without direct supervision, where there is no one to help in an emergency. So yes, some home workers will fall into this category normally anyway, regardless, as I say, of coronavirus. Employers have responsibilities to make sure that the health, safety and welfare of all staff is met, including those who work alone, particularly those who work alone because they are more vulnerable. Working on a computer at home, as we know, and really in an office environment as well, carries a really low risk, but there are other work pressures and mental health considerations to take into account. And the fact that you're away from colleagues, you're away from line managers, which we already touched on. So yeah, they can end up feeling neglected and abandoned. So it's a really important one to include in your risk assessment. Incorporate regular contact with each home worker, making use of video calling software. And you know, it is important. If you used to use notice boards, I use them a lot, and signs in the offices I manage, they won't have access to those anymore. Whether it's goods, like we used to tell them how much we'd saved in terms of paper waste when we started trying to go paperless, and therefore how many trees we'd saved and that kind of thing. All of that stuff makes people feel like they're part of an organisation, as well as the bad stuff like, you've spilt coffee so much, everybody, tell me about all these stains and things, stop leaving it to mark the carpets permanently, whatever it might be. So try and do regular messaging and tell them about the good stuff, tell them about, you know, the bad stuff as well, because it's all part of communication. Don't take your eye off the usual health and safety obligations. We've talked about your responsibilities in general with health and safety specific to COVID, and the riddle reporting, lone workers, and then also looking at some of those aspects of maintenance and health and safety when you open up as well. But there are regular things you should still be doing to maintain your office regardless of this. Don't take your eye off those. These include your maintenance staying on track, so your planned preventative maintenance is still going to plan. If you're due to carry out a fire drill, discuss with the building manager how it can be done so that social distancing is still maintained. You know, everybody should be doing a fire evacuation at least annually. Now, as far as I'm aware, and someone please tell me if you've seen anything, I haven't seen any guidance from the government or the health and safety executive on this as yet. Maybe something they haven't considered as yet because we are only a few months into this, but you know, this could carry on for till perhaps the end of the year. And let's say, for example, your fire drill took place in May last year and you haven't done one since. It's due now, and the law under the fire safety reform or the fire regulation reform is that you need to carry out an evacuation at least once a year with as many staff as possible involved in that. So I would try and discuss how it can be done, and whether actually that you do one with very few staff on site, so you just have a few staff per tenant in the building and everybody maintains social distancing, or whether you write up a report, they write up a report and you review it again in 3 to 6 months and record you know, results and actions. So perhaps you do a proper check on your policies, procedures, the exit routes and so on the assembly point, and you write it up. You send comms out to your staff to say, you know, this is the procedure for a fire drill as a reminder, you know, something else to act in that way. And one thing I did see from the HSE, I think it was from the HSE anyway, was about in an emergency rather than a drill, that obviously if there's an emergency in the building, you know, and there's an immediate threat to life like a fire, or there's a bomb threat, or a bomb's gone off and people need to evacuate, the social distancing element will have to just be pushed to one side, because the immediate threat to life supersedes the risk of contracting coronavirus at that point. And obviously you would hope that if people follow the guidance, as in, you know, if they think they've got it and they're self-isolating and they don't come to work, that risk is still quite low, that people will contract it in that moment that they're exiting a building. Ensure refresher training is carried out. So I already touched on this, but you know, there's all sorts of training that has to be done under the health and safety regs, and perhaps in other formats as well. You know, it might be because you're regulated by the FCA and you have to have regular training in regards to the compliance of that. So make sure that you're not pushing all these other things to the side to deal with COVID. It's still just as important to maintain all these other obligations. Ensure that induction training is still conducted as part of onboarding for new staff and contractors. I'm working with a few clients and I know that new joiners are coming in, they've been hired, they've started at home, or they're due to start in the next few months. So make sure that they're still getting that same induction at a social distance. If you do walk them around the building, it's great to do it, particularly while this is going on, if you've adjusted the building slightly, but keep that social distance. Still get the evidence, perhaps not by getting them to sign a piece of paper at the moment, but get them to email you to confirm they've had it, so it's completely contactless, and keep those records. You shouldn't change any of that. And keep doing your housekeeping checks and include COVID related items and checks, such as door openings, cleaning, sanitation points, signage, etc. You know, there's going to be a big list of things that you can control and you can implement here to help reduce the risk. So include those checks. Other points that might help: cleaning, getting your office ready. I think we've talked about cleaning an awful lot, particularly because we did do the wins webinar, but there are various types of cleaning available. So research your options and agree schedules with your cleaning company or your employee, if you employ them directly, and make sure that they suit. Give them a trial run, and if they don't, change them. Equipment, keep it stocked and safe. I think this one's an obvious one, but still want to put it out there. Hand sanitizer, tissue, soap, hand dryers, towels, and make sure touch points are cleaned regularly. Company owned personal equipment, how can you reintroduce it? We had this come up on a couple of webinars that we did, and I think first and foremost, actually, if I took my laptop back into the office, the first policy to implement, rather than actually having it cleaned, which is what we were talking about, is probably just that no one shares anything. You don't share pens, you don't share paper, you don't share your company equipment. You know, you don't give someone your mobile phone or your mouse or keyboard or whatever it might be. So I think that's the first thing. And then if you want to take that extra step, get everybody's stuff cleaned, particularly if you know they've had coronavirus, an outbreak of it in their household, then get it cleaned through specialist methods like electrostatic cleaning. And you can do it via like a drop off and pick up later service. Is your floor plan up to date? I think hopefully everybody's got floor plans, but if not, get one ready, put names to desks on it, and figure out you know, the social distancing element using your desk space. Indicate who will be in when. You can kind of have a system perhaps with color coding and all sorts on there. There are apps as well, like When I Work. I've used that in the past. It's free up to a certain point, and then I think it's quite cost effective beyond that, which basically have a schedule, so you can put people in there, set up shift patterns, they're all color coded, and then you can email blast it through the app, notifications and all sorts of people in there, so that they know when they're shift working, and then you can export it to Excel and things to show people as well. It's a really good app, so have a look at that if you want some support with the scheduling of different shifts. And amend your travel policy. Again, we did a webinar with Grey Doors Group, Laura and Aman about that. So ask your travel management company for advice to support any new guidance, and you can cover this in your risk assessment as well. And some other points to consider, this is just on the health and safety section. Your building may ask for your policy or your risk assessment, so be prepared to give that to them. They will have every right, because they've got to keep their staff safe just as much as you've got to keep yours safe. Ask for theirs though. If you haven't already, ask them for it now. People, you know, these companies should be preparing for this. And as I say, it might help you to not reinvent the wheel so much. And you'll also then know what they're going to do in the common parts of the building, which will affect all of your staff. Whereas in your premises, it will only affect your staff and no other tenants. So the toilets, how will you manage these? These are just, that's why I've done the sort of scribble thing there. There's just other thoughts I've just kind of dropped into the page. How will you manage going in and out of toilets? You know, if you've got a 2 or 3 cubicle toilet, they've said, you know, to sort of shut off every other one so that you keep that distancing while people are in the toilets. But actually, you know, someone may come out of a toilet and someone might be going in. So you've got a risk of a sort of less than 2 meter touch point or face-to-face point there. So we put things down here like maybe using flip signs on the main entrance door to say people are in here. Obviously that then creates a touch point, so you need to bear that in mind, and you know, continue to make sure people are hand sanitizing, or better yet, washing their hands. Or an anyone in here system, similar to what you would probably have to do in a fire evacuation, is anyone in here, and you know, that kind of thing. A bit more intrusive if someone's sitting on the toilet, like, yeah, not ideal. But just some thoughts, and you guys might have some better ones, so drop them into the chat if you have. Again, it completely depends on your building setup. So I've tried to picture various different setups here that I've seen. Stairwells, lifts, escalators. Some companies have got escalators if they're really fancy. How will they be controlled? Again, probably a building thing, unless you own the building and you manage that in its entirety. And common points for gathering and touching. I've just jotted quite a few down. So print areas, water machines, coffee machines, kitchens and tea points, fridges, doors, cupboard doors, and handles, push bars, stationery, post and deliveries, toilet areas, taps, flushes, lids, dispensers, waste bins, sanitary waste bins. If you've not got pedal operated ones, access control and entry pads, barriers at gates, etc. So some ideas is, can you have a controller for some of those items like printing and stationery, where you just have perhaps someone from your team in office and facilities management doing the dishing out of those items and wiping their, you know, the stationary items, for example, in between, cleaning hands, etc., and handing it over. You know, so that you are giving it to a trusted person rather than allowing everybody in the company into the stationery cupboard where they just want to touch everything because it's all so cool, and you've got some new highlighters or whatever it might be, and you don't know who's touched what, and then who's going to go in there how quickly. You know, it's a lot of it's hard, unnatural surfaces, which is where it can carry the virus. I think they've said even beyond 72 hours now. They're still not entirely sure. So yeah, some considerations there. Does anyone have any points to add or questions at this point before I go on to the next section? Yeah. Jess, but our company are talking to people about returning to the office, but some concerns from staff that will not have choices to use public transport. Should our workplace be providing masks and wipes, and what's people's views? Feel free to unmute if anyone has any views. I'm happy for you to do that and chat, and I'll take a sip of water. But my view is, I don't think it's necessary. Masks particularly have been really controversial, as I'm sure you all know, and I think I talk about them a little bit in here, but they're not completely preventative. So, you know, they've said that it's only really if you've got the virus that you wearing a mask will stop you spreading it. So that's why they would recommend it. But actually, if you're only wearing a mask here, you've still got entry points through your eyes and through touching your face and things available. So the combination of having a mask and a face guard, for example, to stop splutter and that kind of thing is more preventative as someone that hasn't got it. However, you know, how are people going to go around with these face guards on and masks and gloves? You know, we might as well wear a hazmat suit, really. So I think there is a clip I've got on here from one of the train companies that I use, which I think is quite good. But I personally don't think companies should be masks necessarily. Again, it depends on the budget, but I just don't think that's a sort of pressure to put on your company, particularly if they're disposable, because you've got to keep that stock up. You've got to train people then. If you're providing it, you've got to then train people in how to use it and dispose of it properly. And with gloves, the same thing. Gloves are generally task specific, so you wouldn't give someone gloves to wear all day because they would just have no impact. It's like not washing your hands for the day. You need to make sure they're task specific. So someone doing a delivery, they would put them on to pick up the package, deliver it to your house, you know, leave the door, ring the bell, etc., get back in, take them off, and then drive again, and clean in between. So okay, we've got a few points coming in. Zara did a return to work 65% employees said that they should provide. It's a company call. I think if you asked the question as to whether they wanted masks provided, I think you've now got to follow through with that, because you've almost prompted being open to saying, yeah, we can provide this to you, do you want it? So I think it depends on how you phrase that question personally. In the government guidance, it doesn't say anything about having an obligation to provide any PPE. I think if you're yeah, it is covered in the government guidance in there. Okay, they put it in other, so yeah, it's a difficult one. I personally think, like I say, if you start to provide it, you've got to continue to provide it, but you've got to provide that training with it as well. There's some really good videos about how to put masks on and take them off. So if your company has the money to and they're comfortable to, then you can. 65% is you know, a big amount. It's not huge. If it was 80, 90, then it might be something where you kind of really don't have a choice. But yeah, I'm on the fence about that one. I think it might need more consultation, perhaps, with a few of those individuals that said yes, and perhaps people that didn't mention it. Work at a property company and our employees will be required to travel to sites, visit tenants. What are our responsibilities to protect them? Will they be travelling together, Lauren? Okay, So this is what I was going to get onto. If they're travelling together, so one of the things the government said is where social distancing isn't possible, so keeping that 2 metre or 6 foot distance, you need to then consider other options. So can someone sit in the front of a vehicle and someone in the back if one of them's driving and the other isn't, to keep some distance? And if not, then yeah, it's looking at PPE and other options, you know, hand washing, making sure that those people that are travelling together are generally working the same shifts. So you're not mixing employees up all the time, because it just increases the risk. I think that probably needs more of a risk assessment done on it for that specific point, Lauren. There are some guidance I saw. I can share it with you. Lauren, if you can do me a favour, because my brain is like jelly at the moment, and send me an email, I can share some guidance which I saw, which was really good. And I think it's from the HSE or one of the subscription places I subscribe to, where it's specifically for an individual going into someone's house, basically. So if you're visiting tenants, I don't know if you mean business or domestic, but it might help with that. So I'll send that over to you. No problem. Rochelle, you are a company who have been working from home successfully. A few high up staff mentioned returning to work. If we cannot enforce 2 metre distance due to is it safe to continue? Yeah, absolutely. It really is. And that's the point. I think if I just go back a few slides that I put up here, this one here, the government is clear that workers should not be forced to go into an unsafe workplace. So if you know you can't make it safe, you can't, and making it safe isn't just about the social distancing, but we all know that that is the most effective way. If we're not in that close contact with people, then the chances of spreading it are higher, as well as the continual washing of hands and sanitizing of touch points and things. But if you believe, having done a risk assessment, having looked at your environment, that you can't maintain that and you can't confidently put in place other measures, then I would say keep working from home. You know, if anything, have a really small skeleton staff of 10 people or whatever it might be. Can you recommend any companies to assist us with risk assessments and space planning? So the risk assessments I can probably help with. So I have a consultancy that I do called Black and White Office Consultancy, which actually I've been doing for longer than the portal, but it's just not as well known. So I can help with that if you'd like, Thea. And then space planning, I have actually put some slides and companies in here that have done some space planning. So we'll have a look at those in a sec. So that will hopefully help with that. And their company websites in here as well. And we've got some more potential webinars coming up with those companies. So let me just catch up. So I'll stop answering the chat for a second and have a look at that again in a little while and carry on. Okay, so risk assessment, we're getting on to that now. So hopefully this will help, and do feel free to chat any questions you've got whilst I go through this. So there are templates in the portal already. So I think quite a lot of you on the call are members of the portal and probably enhanced members as well, but it's just £10, the one I've uploaded, and I've just, I think just this morning, added some more points to it, because I keep going to bed at night and thinking, oh, I could add this and that or change that. So, you know, it's an ongoing working document. So I will continue to update it and add more as I think of things, to just try and be as helpful as possible to you. But this is the template here. So you can see a screenshot of it. I haven't shared the whole thing because I don't want people to take pictures. You know, I need to earn a living somehow. So, but yeah, this is how it's set out. And I've given quite a few options in there. There's a lot of tips and there's links for further guidance on certain points. But it's really following the same format as other risk assessments that we've uploaded to the portal. This one is specific to COVID. What you could do, and what I'm working on as well, is editing a general office risk assessment to incorporate COVID. So you would go through every section, like manual handling, for example, and you would add a COVID related line to it rather than detailing it separately. So there's a couple of different ways of doing it. To be honest, even if you do a separate COVID one, at some point I would update your general office risk assessment to incorporate COVID, because this isn't going away for some time. And I think I'm in the same boat as a lot of people when we're confident that I don't think this is the last pandemic we'll probably see in our lifetime. So I think by doing it and having that in there, even if you don't refer to it as COVID, but it's pandemic or epidemic, whatever you refer to it as, you've covered it then and you're prepared and you've been through it in real life. So put it down in your normal risk assessment as well. So the government have advised this, always start with your risk assessment. It's the way that you should do it with health and safety in general anyway, is do your risk assessment and create your policies off the back of that. We often do it in reverse. That's not the way they recommend it. So start with your risk assessment and provide training and document it to all and get them to sign off if suitable. Build your policy and roll it out thereafter. Monitor and review and regularly read data accordingly. And as I said, this is a working live document, so you're probably going to want to review it daily, weekly, depending on how often the government and HSE and Public Health England or whatever jurisdiction you fall under releases their advice, as well as when you start to do things and you learn more about what's going on. Share with your directors, partners, line managers, you know, the senior stakeholders, the people responsible for health and safety, the people that will be liable if this you know, if something happens. And decide on your matrix grid. So are you going to do a 5x5 grid? Are you going to do a 3x3 grid, whatever it might be? And if you've done risk assessments before, you'll know what I'm going on about. If not, I can explain. But jot down all the hazards and start to pencil in what controls you're going to put in place, who would be affected, what is the current and new risk, etc. So I'll just quickly go through. So you would, you know, this is a template I feel comfortable using. You'll see loads of examples out there, but for me it's detailing all this stuff at the top. So what's the reason for the risk assessment? You know, expectant mother, manual handling, COVID, going back to the office, who's responsible? It should always be your health and safety officer unless you've got that broken down. The location, office, you can put the address in there, or multiple offices, multiple sites. You know, like for example, in Lauren's case, you'll probably need to do one of these for the workplace, and you can still put it in here perhaps, and one of them for going out and going and seeing these tenants. So, you know, public premises or business premises, whatever it might be. Data risk assessment, date of event task, well, this is ongoing, and the name of the person that's assessed it and sign off. So we're looking at what the location and the activity is, it's office, workplace, and it's general work activities, so spreading and contracting infectious diseases, namely here the coronavirus. Who could be harmed? In a lot of these you could probably put everybody, because it can spread, so it's not just the employees, workers, contractors, visitors, clients, etc. It is then also the families of all these people, but I've tried to keep it simple and only put that really in a couple of sections where it's the high level spreading of it. And then what the risk is before you put controls in place. So the likelihood, A is high, highly likely, you know, particularly if you don't have controls. So you imagine this where you just go back to work and you don't put anything in place. Well, it's highly likely people are going to contract it. And the consequences is death, basically. It's deadly. So it's the highest possible consequence level, which means it's critical as a risk until we put some controls in place. So I've documented some there, have a read of them in your own time. The likelihood then can be reduced down. It's called a residual risk to a C. So it's kind of sitting on the middle. This grid goes 1 to 5 in terms of consequence, and A to E, I think it is. I don't know. I've lost. Trying to teach my son at the alphabet, and I've lost it in my own head. A to E in terms of likelihood. So we then bring it down to high, and I think you still have to keep it at high, because you can't control every single person that's coming back to work. You can't say, Hannah, have you washed your hands? Have you washed them in the last 20 minutes? I saw you touch that thing there. Go and wash your hands. You can't. So you need to just be sensible there as to what you can control and implement and encourage and enforce in some cases as well. So continuing on, go to the office if you can. I think this is a really sensible suggestion that I actually thought of only just through the night last night. But if I was going back, I'm still on maternity leave from my part-time position as an operations manager at the moment, but if I was going back, or if I was there, sorry, and people talking about going back, I would say, right, can I just go to the office on my own? I don't want anyone else there before we do anything. I want to take my time. I'm going to walk around with my notepad or my iPad or whatever and jot down hazards and visualize. I'm quite a photographic sort of memory person. Visualize what happens day to day when people are in there, when someone walks into the building, when they go up in the lift, when they get to reception and they put their coat up on the coat rail. We're coming to summer, but it will be winter before too long. You know, do you have common coat stands or coat rails where there's touch points? The people often come and stand at the reception desk and put their hands on, morning, how are you doing? Take a mint or a sweet. You know, all these kinds of things that you'll want to think about and just go, right, let's take all of these touch points and opportunities for touch points that we can't control, because you can't regularly clean everything every time someone has touched something. It's just impossible. So take all the temptation away from them, all these kind of fidget points I think I've put down here. And yeah, note down possible hazards, risk areas, and how you mitigate those. E.g., do you put those screens in place? And I've got some products to show you. Reducing or limiting activity time. So if someone's in a meeting and they say we have to have meetings, try and put a cap on it and say, right, well, meetings are now restricted as 20 minutes. You've got to make them constructive. If you want face-to-face meetings, limit the time. Or other work activities, you know, I don't know, these sort of stand-up meetings and all sorts of other things that businesses want to do. Surface cleaning, hand washing, etc. Where are your pinch points? Where are those points where people can bump into each other? Like I said, at the toilets, they're coming out, someone's coming in. We're less than 2 meters, you know, that kind of thing. High points and low visibility areas as well. So this one, for example, no worries, Jessica, it's all recorded, so hopefully you'll be able to catch up. This one is important. So a lot of doors in buildings don't have VPs, vision panels through them. Meeting rooms, toilet doors is another one. So considering whether you can pin a lot of those doors open and be wary of fire doors, because you'll need to make sure that you're keeping those closed if it says fire door, keep closed on them and they're a fire rated door. But yeah, making sure that you're thinking about your low visibility areas. If you've got right angled corners which have the ability for one person to come one way and come the other and not realise, all that sort of stuff. We talked about that point already. Can you place signs, add arrow directions, etc., and rate how likely the risk may occur and the consequence of that? We've talked about that bit. And redate them once you've established controls. And there's a link there to more information about risk assessments from the HPC. When you've then done your risk assessment, they've printed in, or they've shared in this document, and the link to the document is on the first few slides, this poster here. So you would get one of your directors to sign it and date it, who to contact, so maybe yourself, or if you've got an external health and safety consultancy, we do that for some businesses on a retainer, so they would put us there. But you would, yeah, display this poster once you've done your risk assessment as a commitment that you have done all you can thus far to keep your employees safe. So they want you to share the results of your risk assessment, and they don't necessarily mean your risk assessment, okay? If you share that with your employees, you're likely going to get a lot of questions off the back of it. What you'll want to do is develop a policy. So like with a general office risk assessment, you wouldn't necessarily share that with all your employees. You would share the policy and say, here's health and safety policy, because it goes into a lot more detail. It really sets out your responsibilities as an employer and theirs as an employee. So don't take them saying share the results as meaning put that risk assessment online. For businesses over 50, they expect you to put it on your website, which is completely fair enough. It's a really accessible way for your employees to get to it. And they want to ensure that you put that poster up. I've just put here, put it on multiple floors if you have multiple floors. People will likely not be going to floors that they're not based on. So don't just put it on your notice board on one floor in your main kitchen, put it on lots of floors. You can write a brief policy advising of your and their responsibilities, as I said here. So, sorry, what is popping up? Okay, we've got a chat here. No worries. In our office, most of the staff bring in their own food and put it in the fridge. Staff go to the fridge all day long. What would you suggest about the fridge? Yeah, so to be honest, I would try and stop people bringing food in that needs to be refrigerated. But that's a really difficult one to do, and I think that will come down to the amount of people that you allow into the office at any one time, because that will help minimize how much is in the fridge, and milk obviously as well. So I think it's a case of having signage up, hand sanitizers, sink hopefully nearby. If it's in a kitchenette or tea point, you would expect that anyway. And in red is like warning colors to our brain. Wash your hands after using this fridge, wash your hands before going in the fridge, that kind of thing. So yeah, hopefully that helps, but I would try and limit the use of all these sort of common touch points by offering alternative means if you can, which is difficult to do. So moving on to premises now, we've still got a little way to go. So yeah. Sorry, I'm just chatting. Okay. So implement 2 meter space desking up against walls if feasible, so face to face with a wall rather than face to face with each other, because then there's no opportunity to pass it, because the wall's going to take most of someone coughing or sneezing or whatever. Hot desking is a no, unless you have a system for cleaning in between or using protective equipment, and the government have referred to this in their guidance as well. Desk shield screens, meter, etc. Avoid hot desks, as I've put there already. There are some products I've seen, I meant to put one in here actually, I've just remembered, which is like a cover you can get for the desks, and I think it's sort of automatically antibacterial, so it stops the spread, so you can have the shield put on the desk and it will stop a lot of that contact. And prepare and place signage, wash your hands, 2 meter distance, don't touch your face, etc. Have a one-way system around the office if possible, prevent bottlenecks, you don't want that, and obviously keep fire safety in mind. So if you're significantly changing the routes and the layout of your floors, you may need to consider getting a fire risk assessment redone, because that will have an impact on how people exit the building. Or it might be that you have the signage in place and you communicate that in a fire evacuation, completely ignore all the signage, just use your nearest exit route, don't worry about the signage at all, don't worry about the 2 meters, etc., as already alluded to, but just keep that in mind as to what you're going to do there. Close down block of common areas such as print rooms, post rooms, tea points. Offer bottled water dotted around the office instead if you can, or if you've got water coolers, place them outside around the office open area rather than within a tea point, which is a little bit of a smaller room. Place anti-bac and wash stations strategically around the office and use auto cleaning products. Open doors with door stops, check they're not fire doors, however, as already mentioned. Check your coffee machines, go through cycles, fridges, clean and empty them, they might be smelling now. CCTV and access control. Stock levels and consumables, empty waste bins and place strategically around. Stop again people needing to move too much and risking that sort of contact. Make sure the power's working, and maybe we all want this, right? This is the dream. Everybody puts their items when they're finished with it straight into the dishwasher. They don't leave it on the side, meaning someone else has to touch it or move it. Everybody puts their stuff straight into the dishwasher. I expect you're all laughing now, but this may be the turning point for us as office managers, where people actually understand that's what they should be doing. And obviously wash hands before and after, or certainly after. Meetings should be by telephone and not in person. Deliveries from suppliers. So I don't know if you've been doing it, but Amazon's been a great delivery for us whilst we've been in lockdown, and other deliveries like fruit and veg and things. We tend to either just leave the stuff for a few days before we open it, depending on how desperately we want it, or we clean it, we wipe it down, we wash our hands afterwards, that kind of thing. So thinking about deliveries and your procedure and process there. And limiting who may have contact with the delivery drivers and that kind of thing. They should still be doing contactless deliveries and so on. So thinking about that. Sorry, slides are going all over. So this is one of the pieces I've mentioned to someone's question earlier about companies who can help do this. So Active Workplace Solutions are one of our partners in the portal, and there's a link here to their website. But this is something they did for one of their clients early on, about the 2-metre distancing. So you can see all the green where it's safe and the red where it's not safe, and the sort of clash zone. So yeah, something like that's a really helpful exercise, and it's quite easy for these companies to do it because they have, if they have DWG or CAD drawings that are the architect drawings with all the accurate space measurements on, then they can really easily implement that kind of exercise. And in practice, so I've just done a really quick rough plan here to show you, but you know, if this is your office, it's a small one, it's a dead end basically, but what are your desk widths? It should say what are your desk widths? Are they 1200, 1400, 1600? Measure those, because you know you'll need to know that to be able to do this. Back to back measurements, what's the space? How can you prevent face-to-face and bottleneck contact? One-way system for desk areas. And then I've just done a really quick drawing here of what I would potentially do if this was my office. So to try and have, you know, as few people, but also maximise the amount of people that I could have at any one time, I'd shut off all those desks. You can see I've shut off the sofa area here and moved another desk there. So they're not face-to-face now. Put some hand sanitising stations in sort of 3 key areas. And I've also done a kind of, I've put a screen up as well, sorry, for these 2 here, but I've also done a give way sign system. So I think of this as much like driving a car, and all these signs we have, and traffic lights and things like go, don't go, and give way, and you know, priority to the vehicle coming ahead, and you get priority, and all that kind of thing when you're crossing vulnerable bridges and stuff like that when you're out and about. Think of it like that when you go into your office and do this test. So, you know, it might be that you put a give way sign here that says give way to oncoming traffic, quite literally, and it means that you have to wait here if somebody's already coming down the corridor. You know, if it's a pinch point and a narrow route. Tips in relation to people: stagger working hours, implement shift working, consider a phased approach back. I think that's really important. Skeleton staff, fixing teams so that you're not intermixing lots of different staff. It's a fixed set of people going back at the same time. Limited to so many people as deemed manageable as a number at any one time to be on site. And do a trial run with a few trusted staff. So whether it be your seniors and then a few other people that you trust to be sensible, to give good feedback, or you know, negative feedback, but you know, feedback that's constructive and helpful. Do a trial run for days, weeks, months before you go back in, and make sure it works properly. Breaks should be outside or at their desks and not in common areas ideally. So eating at the desk, there's a lot of companies that have don't eat your desk policy. That can go away now. You know, that desk should stay as that person's ideally the whole time until this is really sorted. So they can eat at their desk. Continue working from home if it works for you and employees. Check in with them. We've spoken about this already. It's really important. Encourage DSE self-assessments. It's a long time now that people have been working from home, so the HSE will probably start to adjust their guidance on that. I think they already have. So make sure that you are giving them some support there. And assess your high-risk employees who are vulnerable. It talks about this in the guidance, but it's really important to either do a generic risk assessment on your vulnerable people and what you'll do to protect them. Generally, don't let them come in. Don't force them to come in. They're at high risk. You know, people that have got the heart disease, all the people that are more susceptible to suffer from COVID if they contract it. And ensure you're abiding by the Equality Act. It's really important because you need to be seen to be treating everybody fairly here. Consider supplying staff with PPE or advising them that they can wear and bring their own. Masks are controversial and not fully preventative. So there's some advice there that I've shared on the WHO. So we've spoken about that a little bit already. Temperature testing is effective, so consider it for employees prior to letting them in each day. And an external temperature reading, because no one's going to be doing an internal one, I hope, is that it's 37.8 degrees or over. Carry out DSEs for those who return to work as well. They haven't been at these workstations for some time. If you start to put them at different workstations, you are changing and modifying their workstation, which is one of the triggers for doing a new desk assessment. So yeah, when people do come back, try and encourage them to do a desk check self-assessment. And travel to the office and business travel should be restricted. Advise against using public transport where possible, and provide alternative means if budget allows, for example, taxis, cars, driving in, carpooling if they can do it safely. and parking. You know, if you think about it, if 2 people or 4 people, or even from the same organisation, are in a car together going to a meeting that's one of the person's cars, or it's a hire car or whatever, it's much better than all those 4 individuals going on public transport, because it's a lesser risk for all of them. So, you know, it's thinking kind of outside the box there on, okay, there's slightly a higher cost there, but the chances are if they're travelling for business, they should be reclaiming on that cost anyway. So is there an alternative means that puts all those people at a lower risk, and maybe they do wear masks in the car and wash their hands before and after and all that kind of stuff, but that's much better in my view than putting them all on public transport. This is the one I talked about that I grabbed from an email I got yesterday. So they've just done this this campaign. So they recommend face coverings, which I don't think is too unsensible, because social distancing is very difficult when you're on these trains and on the tubes in particular. Use contactless methods and keep apart. And the reason I put this on here, for some reason my little pop-ups aren't working that I've had throughout this, but I think this is a really good simple campaign as well to share. So with that in mind, when you figured out what your 3 or 5 key points are to send to people before they return to the office, something like this email could work really nicely to email out to everybody and to have on posters in your office to say, you know, travel safe, travel smart, stay apart, or whatever. You know, don't go in and drink the coffee, bring your own coffee, whatever it might be. Whatever your 3-5 points are, that's a nice layout. Oh, they're working now. Here we go. There we go. And Canva, if anyone uses Canva, I've started using it quite regularly. It's a really good place where you can design things like this. So, top tips, procedures and policies. Increase your cleaning frequency, discuss with provider, focus on high touch points, desk services and equipment. You will need to prove and monitor the procedures for this with a checklist or timesheet, because again, it's something like the HSE will probably check in on. If you're committing to doing it, they'll want proof of you doing that. My thought, again, at like 4 o'clock this morning when I woke up, for whatever reason I did, was actually do this quickly. If you're going to increase your cleaning frequencies, do it quickly, because if you're like any of the offices I worked in previously, you might only have a cleaner for lunchtime for 3 hours or something, from 11 till 2. And the chances are that cleaner before you have them and after goes to different buildings. So start having these conversations with your cleaning companies now to find out what's available. Cleaning staff will probably not all want to come back to work. A lot of them will probably have to self-isolate. Some of them may be at high risk, so the resources may be less than what's normally available as well. So start to have these conversations soon with your cleaning companies. Ensure staff who are ill don't come to work, and follow the sickness reporting procedures. Agree a procedure for bringing equipment back. We've spoken about this already. Order PPE ASAP and maintain your stock levels with suppliers. I've mentioned about gloves there as well. Communicate whatever your policies are and provide them with options where possible, and also, like, communicate with your furloughed staff. Employees are just as responsible as employers. So where health and safety is concerned, if anyone deliberately contravenes anything you put in place, you can take them through disciplinary proceedings. And have everything readily available, written up, and review it regularly. Add it to your intranet, your shared drive, etc. Advice is ever changing, so your policy and related documents need to be as up to date as possible. Right, we're going to get on to products. So if anyone wants to unmute their lines, ask any questions, share any advice, chat it, whatever you want to. We're just going to kind of go through some bits here, so it's a bit more informal now. There are hundreds of products. I'm sure you've seen people posting stuff on LinkedIn, and you're getting emails from suppliers and so on. People that sold plants previously are coming out with, and coffee are coming out with all sorts of hygiene products. And I get it, because businesses need to evolve and stay afloat in this time. It's demand and supply, right? We're going to demand it, so why not supply it? I have agreed with one of my suppliers that I'll supply a particular, if anyone wants it, a particular hand sanitizing station, which I'll show you. So if anyone wants information on that, but with all these products, I can put you in touch with the suppliers. So research the options and the costs, what's suitable for your business, brand, premises, culture. You know, if something really goes against the culture and the ethos of your business, why do it? Just, you know, for pressure points, if there isn't really a benefit to it in terms of mitigating the risk. Don't do it just because everyone else is. Consider whether it actually has a benefit. You know, it's that reasonably practical thing again. You can potentially save money on these by just not letting people go back to work as well. So remember that is always an option. So crystal cleaning, one of our partners, this is what electrostatic spraying looks like. So they've had a lot of clients getting ready and doing that before they go in, and then perhaps doing it regularly once a week or every other week just to try and kill anything that's there. Signage, here's some signs I've seen. There's so many around, and obviously you can create your own as well. There's stopping the spread. I like this one. I think it's really simple to compare to some of these. There's a lot of information in there, and you might want to put that up, you know, on the back of toilet doors and things. But this kind of thing around the office, just like a 3 or 5 step piece, is really simple. And there's me touching my face as I look at that same thing. Signage on the floors. Some of these have been taken from our suppliers, so like crystal cleaning, this one. You'll recognise some of these from supermarkets, but it's a really good place to look and go, okay, well, that makes sense, I'll do that. You know, marking out the floors and sort of taping down to say, you know, keep your distance, or this is a no-go zone, or taping up chairs of sofas to stop people sitting. You may have seen it if you've been to doctor surgeries and things, stop them sitting in one half of the chair so that they can only sit in the other, which is then furthest away from the single armchair or whatever. Lifts, something to consider there as well, depending on the size and space you have. This one I really like. This was taken from the government guidance as well that I just added this morning. Obviously, it would be quite a lot to do this, but this particular flooring here is quite a nice example to show what zones are safe and the actual spacing that they can put between each of the desks, and kind of not to go beyond certain zones. And then they've got green markers to limit desk usage and maintain social distancing. So green is a good desk to use, and red perhaps is you can't sit here. You've probably all seen these, but there's the screens and the barriers for desks, meeting rooms, phone pods, etc. available. This is the sanitation station that I can get for anyone if they want it, and there's a YouTube there. It can be branded to your own brand if you want to. It's a pedestal, so it's a no-touch one. They're retailing at around £280 to £300, something like that. And if you buy lots of them, the price of that goes down. There's these by Crystal Cleaning, I think this one is. So this one's got a little bit more in there. This is the Emperor, so it's a penguin shape. And quite smart. You can have these in white as well, and I think you can get them branded, but they can be fixed to the floor. And then all sorts of other stations here, so you can even have plants put them in them if you want to. Budget dependent, so these are kind of the top end of the range. These two are about the same price, these three are about the same price, and then these are kind of lower end of the range, and this is like a desktop one. And then this I thought was quite cool, so I thought I'd share it. It's around, I think it's around about £2,000, something like that. But this is a way to basically make your own hand sanitizer. So there's more information there if anyone wants to have a read, but it attaches to your water system. And there's a smaller one, I think it's like £400, £500, so you can have it at home on your own water system at home if you really want to do. I guess over time it would save a lot of money. But it basically means you can make your own, make your own hand sanitizer or sanitizer. So that's quite cool. Again, one of our partners is doing that. They're a fit out company, so they're selling it and fitting it in offices for people. So if anyone wants details, let me know. Other products. So yeah, a thermometer reader there. I think that's a couple of £100 or so. I have got some of the prices up here. Cup and lid dispensers with a hand sanitizer station on the end. So Renew and I think Thea as well, where you mentioned about coffee, that might be a good one. So it's right there, or you have it on the wall, or just desk mounted next to them. But yeah, hand cleaning is the best thing to do, as we all know. And then other resources and webinars. So these are some of the other webinars we've done or we've seen that are really good. Say contact me if you need any support or contacts for any of the products. And then I've just added a load of useful links that are constantly updated from the HSE here on this. So we've got about 10 minutes and I need to get on another call with a client, but are there any questions, comments, suggestions that anyone wants to share? I'd be really keen to hear from you and what you've seen and what works or concerns, etc. And I hope that was useful. Is anyone still there? Okay, good. Pleasure. What I might do, so obviously we'll upload this to YouTube and put the slides and everything in the link to it on the portal. And what I might do, if you think it would help, is maybe every couple of weeks do something like this. So I can run through, not obviously the same slides, but the same sort of context to keep the messaging the same, and then obviously update with any more advice that's coming out, and we can just keep opening up with questions and advice. And hopefully by that time some of you may, well hopefully not actually, but some of you may, as we progress through it, have gone back to the office or have started your risk assessment or finished it, and so we can share ideas with each other in our wonderful hub. Pleasure. There is an awful lot to do. Yes, someone's just messaged privately saying there's so much to do before staff can go back. It's really overwhelming. But just, I think my advice is just take the time, ask your directors for time. If the pressure falls on you and your shoulders, ask them for time. You know, you don't want to put people at risk, and you don't want it to fall on your shoulders if people are put at risk, and for questions to come to you saying, well, why didn't you say, you know, that we shouldn't open up and that you're not ready. You know, have a voice. You have a voice here. Make that known and let people know that you're not ready. I did do a survey actually on Instagram for anyone that follows us. It's the office management group, and did a quick survey this morning. If I just have a look, yeah, as suspected. So I asked, do you feel ready to go back to the office? 100% no. Have you completed a risk assessment? 75% no, 25% yes. So that's pretty good. And are you confident about opening back up? No, not ready for it. That's 40 odd people that have answered that. So, you know, a quick poll on Instagram, and I think everybody's in the same boat. I'm here to help. So if anybody does, as I say, I've got a consultancy, if anyone wants some help with their risk assessment, you know, maybe I could consider coming into your offices and we stay apart and we do it together, providing nobody else is in that office other than the two of us, and we look at it together if anyone wants any help like that. You know, I can drive to London quite easily from where I live, or wherever. But yeah, if anyone wants any help, their risk assessment looked over, then let me know. But yeah, I'll keep adding, updating and whatever I can to support you all. Okay. All right, I will end it there if there's no other comments or questions, and I'll see you all very soon. Take care.